My name is Ryan Furman. I'm a physical therapist and also a certified athletic trainer. Gary is a man who has two major problems. The first one is that he's got severe osteoarthritis in both of his knees. No cartilage left, no chondral cartilage, no meniscus, no nothing. And he also has some foot problems and has had numerous surgeries on both feet. And then he has a problem with obesity as well. And he came to the clinic for some therapy because the physician, they were considering doing knee replacements, but didn't want to attempt a knee replacement on a man of his size. And so the purpose was twofold. One was to see if we could do some activities with him so that he could lose some weight and become a better candidate for surgery. And then secondly, we wanted to see if we could increase his strength, increase his mobility, increase his overall function, again, make him a better candidate to have a surgery and making him healthier in general. He had very poor mobility in his knees. His range of motion was poor at best, and his ability to walk was awful. He required a scooter to go any distance at all, and a walker to get short distances. He had to be on a walker for short distances. That walker initially he relied upon, from the time he left his car to go back to get his scooter, to come into the clinic, and he would lean on the walker when he walked because weight bearing was so difficult for him. Along with the amount of pain that he was having from his knees and his feet both. Oh, Gary also suffers from back pain, probably based on his size more than anything else, but does have some back pain, and that came into play a lot when we used the pool for his treatment. He had tried some other things. I think he'd even been to another clinic and tried some other things and just did not tolerate anything outside of the water. And I don't know if that was on the video or not, but you see him go from getting in the water to getting out, and you see a person change. In the water, he's got freedom of movement, he can do some things. He gets out of the water, he looks like a different person because he just could not do things, with the effects of gravity that he could do in the pool. One of the major things we did was, of course, walking. He needed to get exercise, he needed to burn calories, and there's just no way of him really doing that effectively out of the water. But we put him in the water, and initially he was walking at 0.4, 0.5 miles an hour for 10 minutes, and that was all he tolerated. Well, but by the time we'd come to the end of his treatment, and he came in not regularly just because of his circumstances, but as much as he could, he came in over the course of about 5 or 6 months, which is a lot of therapy, I realize. But by the time he finished, he was walking and exercising for an hour in the pool. And he was walking at 2.5 miles an hour, and walking a lot of distance, which he could have never done before. One of the neatest things with Gary was the change we saw just in general overall. Towards the end of his treatment, when he'd come in and park his car, instead of having to walk on his walker to go back and get a scooter, he could walk without the walker and get back and get a scooter. He could do things without the walker. It was a significant change in his overall function, significant. Of course, he used the treadmill, and then the jets with varying speeds on the jets and on the treadmill. We used that workout platform quite a bit with him. And one of the nice things about that platform was that we put him in the deeper water initially to do exercises, and as he improved, we'd move the railings out of the way so he didn't have as much to hold or balance on, and we got him up on the platform where he had less, he was more weight bearing on the platform than he was not on the platform, and even that difference in 8 inches made a difference in the amount of weight that he bore, and that was noted in the fact that he improved the things he did out of the pool. We could see that difference. So other than that, we used some exercises using paddles and the frisbee that encourage core stabilization. When somebody like him that hasn't been walking and very functional for so long, even though his core wasn't his diagnosis, we needed to work that core and strengthen that core so that to improve his ability to walk and his ability to get around and his overall function. And he saw a big change in his back pain as well, which is kind of an aside. We weren't treating him for back pain, but he noticed a big change in how he felt with his back just by doing those exercises and stabilizing his core and losing some weight. He lost, over the course of about 5 months, he lost about 25 pounds. the HydroWorx pool gives us so many options of things that we can do, and of diagnoses we can put in that pool. The treadmill and the resistance jets and the ability to take the handrails in and out, so that patients can go from environment of stability to less stability. The ways that we can work balance and proprioception in the pool that for many patients, especially a patient like Gary, for example, would just be impossible. We couldn't do it on dry land safely. If he were to lose his balance outside of the pool, it'd be very difficult for anybody to stop him from falling because of his size. Or in particular for him, it was necessary for us to be able to have that HydroWorx pool. And having that step and having the side jet, I don't think we used with him, but we've used with other patients for scar massage after that are post-op patients that have scarring. We get so many options out of the HydroWorx pool, and it's a safe environment, and the ability to easily lower or raise the level of the pool. We've had to do that with patients that are shorter, to lower the level of the pool so that they can breathe while they're exercising. Those things that are made easy for us have been very, very convenient and very important to therapy and to rehabilitation in general.